Hello, everyone, and welcome to today's industry webinar, Provider Relief Fund, New Details Announced. My name is Ellen Knowles. I am the Marketing Communications Manager at Azalea Health, and I will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. If you would prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed there. You will have the opportunity to submit questions during today's webinar, and you can send them in at any time during the presentation. We will address them at the end of the presentation during Q&A. With all the ongoing changes, we want to have a very interactive Q&A session, so please take a moment to submit that. Also, please keep in mind that there are new updates being released weekly and sometimes daily. So if you have any questions that we are unable to address live today, we will follow up with you separately and cover that. Also, please note that today's slides will be shared in a follow-up email along with the webinar recording after the presentation in case you want to review again or share with any of your peers. I would now like to introduce our presenter today. We have Margaret Chandler, Azalea's Clinical Regulatory Consultant. With that, I'll go ahead and turn today's presentation over to you, Margaret.
Hello, everyone. Thank you so much for joining the call. I hope we can answer most of your questions. I'm going to be upfront. This information came from a call, not directly from the rule, because the rule just came out this morning. So there's still a lot of questions, and we'll be getting those answered over the next few days. So just so you know where this is coming from and why I don't have more answers, is it just happened too fast. So what we're talking about today is the more details about the Rural Provider Relief Fund, and this is the second round of sweeping changes. And this latest round is stating that most RHCs will receive funds. No application is needed, and you might have already gotten your funds. And one of the criteria is that the RHC had to have a medical CCN number, a CMS, that's the CMS hospital number. And so that's why I say most, because if you didn't have your CCN number until after December 17th, you wouldn't be getting around. Now, like I said, this is the new interim final rule. Because it's an interim rule, there is a comment period. So if there are things that you're not liking about this, please go out and comment. If you need help with that, just email us at regulatory@azalea.com, and we'll be happy to help you get your comments out there, because I can't express how important it is for people to comment, because that's how changes get made and things get better. So please really give it some thought. The name of this new rule, a part of the name, is Additional Policy and Regulatory Revisions in Response to the COVID-19 Public Health Emergency. So our next week, our webinar will be on the details directly from that law, in addition, which will just build on what we're covering today. Moving on, what we're going to talk about next are the different situations, the different types of RHCs, and how this will affect them, how you're going to get your money, that kind of thing. So for independent rural health clinics, the money's paid directly to the clinic. However, you're enrolled in Medicare or Medicaid. And this is what they said is every federally certified rural health clinic, including pediatrics. But just remember that December 19th date. So, as long as you had your CCN by December 19th, you'll get your money. And that's all that I know about right now about independent rural health clinics. As far as provider-based rural health clinics, if they're owned by a rural hospital or a CAH, the money will be included in the distribution for the rural hospital or the CAH account. Now, RHCs owned by urban hospitals will not receive any funds from this allocation. So there is a formal definition for urban hospitals in the law, so I'll have that for you next week. But you probably already know if you're an urban hospital. Next up is provider-based RHCs, and this is owned by non-rural hospitals. And so I know I just said that rural urban hospitals would not get any money, but this is talking about provider-based health clinics. I just want to point out the difference that here we're talking about clinics. On the last slide, I was talking about hospitals. So if you're owned by a hospital, if you're a clinic owned by a hospital, your money will be sent to your parent hospital. Hope that makes sense, but please feel free to ask questions if it doesn't. Now we get into the really important part, the payment amounts. They're going to vary depending on your operating expenses. And they don't know yet, they haven't decided yet how they're going to determine the operating expenses, but everybody that is eligible will receive a minimum of $100,000. And that the average distribution is expected. Now this is just an estimate, 162,000 for the average RHC clinic. The average estimate for rural hospitals and CAHs is 4 million. So like I say, these are just guesses really. We'll have to see how they're going to calculate that operating expense before we would really know. And we're expecting an update on that any day now. So that's everything I have in my presentation. So we're ready to just jump into your questions. We're trying to save as much time as possible for your questions. So I'll turn it back over to Ellen to get the questions for us.
All right, thank you, Margaret. Yes, we will begin answering questions submitted during today's presentation. As a reminder, you can still submit your questions in the attendee control panel. Our first question asks, what data is being used to calculate the RHC's average operating expense?
Oh, that's what I was referring to on this last slide, that they have not told us how they're going to calculate that or what data they're going to use. So we've gotten that question a lot already, and unfortunately, we just don't know yet.
All right. Next question. How will I get my money if I don't receive payments from CMS electronically?
So electronic is the best because you get them sooner. But if you don't receive electronic, it'll be a check just like your reimbursements, and obviously it'll just take a little bit longer because they have to print the check and mail it to you. So just watch out for your big check.
All right. What about Medicare low volume hospitals?
Can you put in a more specific what you want to know about them? Are you saying not a non-CAH, I guess?
Let's see. They wrote back in and said an RHC is owned by a low volume Medicare hospital.
I don't have the information on that yet. I'll have to see what they have in the law about low volume hospitals.
All right. We'll follow up with you on that separately, Chris. Okay, next question. I see that this money can be used for loss of revenue. Do we need to offset any of the stimulus funding we are getting?
So the stimulus funding can be used for anything impacted or related to COVID. So if you're suffering that loss because of COVID, then you won't have to offset it. If you're suffering the loss from another cause, you would presumably need to refund that.
All right. We did have someone write in regarding the date, December 19th, if there was something that needed to be done by December 19th that you mentioned.
Yes, it was December 17th, and you needed to have your CCN number from Medicare by December 17th in order to be eligible for this money.
All right, great. Thank you for clarifying that. Um, Next question, how much are we supposed to receive if we are a rural hospital with rural health clinic provider based?
Rural health clinic provider based.
Yes.
Since we don't know how they're calculating it, I can't speculate on that. Hopefully, we'll be able to provide that information on the next call. I'm hoping it's in the rule or they will have published something by then.
All right, so we'll follow up on that one separately. If we receive a lump sum as the parent organization, how do we know the breakdown of each clinic?
Here again, I don't know for sure, but I'm assuming that that will come with a remittance advice or something that will tell you that. But that I will look into that further and try to get an answer.
All right. Is this payment going to be considered income for the cost report for RHCs?
That's another one that they haven't published the answer to yet.
Okay. Next question, we have been told that the funds will be based on COVID expenses. If we don't have COVID expenses totaling what we were sent, will we have to refund the difference?
So you would, if you don't have any COVID expenses. So that's the short answer. The longer answer is that it doesn't have to be just expenses. You could make purchases. For example, somebody had sent us a question directly. They were going to purchase a mobile unit so they could drive around and treat, to do testing and that kind of thing. And initially it was going to be used for COVID. So you can purchase more, a better speed of internet or expand your internet, or it can be anything as long as you're doing it because of COVID. So I just say that because I hate for you to have to send that money back when you could probably find something related to COVID that would be considered an expense.
All right. Our next question, can you confirm the number of payments the government has sent thus far? They named the PPP, the first phase of the relief fund, and then a second phase of relief fund. Is there a fourth payment distribution?
No, it has been very confusing because it's all that initial 100,000 or dollars. They just split it up into 4 different kinds of distributions. So they did, the first distribution came from the general fund, and then they set up the other one, the relief fund payment, and now here's a second one. I'm sorry, this would be the third one. And so they're just stringing it out, I guess is the best word. And I say that with the caveat, unless I find something else in the law that I haven't found yet.
All right. And we've gotten this question a couple times. Does the money have to be paid back?
It only has to be paid back if you did not use it for COVID. So if you don't need to put it toward expenses because of reduced volume or something like that, or because of all the extra supplies you need to buy or whatever, then you can either buy something or some things COVID related, or you can send the money back.
And we're getting several questions regarding do we need to submit reports or documentation showing where the money was spent towards COVID?
I think you would, there are that attestation where you have to submit some information from the last 20 billion that was released, but it's you'll need that in case you get audited, but that attestation is the only thing I've seen so far. If I find here again, I would expect that they will come out with that, because how can the government just throw this kind of money out without some kind of accountability? But as of right now, all I know about is the attestation. We'll get that word out to you as soon as we find out if there's something new.
All right, next question we've got here. How can we be sure the money was received if we got paid electronically? Is there something we should be looking for?
So you mean like as opposed to your 835s? I think that's what you're saying. You can tell when you get a reimbursement because you have your 835 files, but this isn't a reimbursement, so you don't receive anything saying, hey, that money is there. I believe the only way to know is to just check your bank account.
And I know that most funding for this wave should be paid out this week, as Margaret mentioned in the webinar. So some clinics have already noticed that they've received the funding. So just keep your eye out for that. Next question we have is, what is a CCN number, if you can explain that again?
A CCN number is assigned to a hospital. That acronym stands for CMS certification number, and it used to be called the Medicare provider number or Medicare ID, and they just changed it for whatever reason to CCN number. So it applies to that only applies to hospitals.
All right. Are clinics associated with RHCs available for stimulus as well?
I'm sorry, Ellen, would you repeat that?
Yes. Are any clinics that are associated with RHCs available for stimulus as well?
Yes, they are. If they are rural, in a rural area, as opposed to an urban area.
In rural, okay. Let's see, got some more questions coming in. What do we do if payment has not been received yet?
You would need to call the CMS help number. There are in the links, we have links at the end of this document, and every single one of those links has the numbers that you can call to follow up on your money.
All right, and then just to clarify again regarding the COVID expenses versus COVID loss, is the funding specifically for COVID expenses or COVID loss of revenue?
Both. It's to cover expenses, help with loss of revenue, and help with any purchases that you might need to make or want to make to treat COVID patients.
All right, great. Can this money be used to purchase vehicles to transport our patients or to take medical providers to patients' homes affected by COVID?
Yes, because you're buying that specifically for COVID, so that would be totally acceptable.
All right. Could you explain a little further on the attestation for these funds?
So the attestation is on the provider relief fund, and it primarily is asking you there's a list of terms and conditions, and that you have to say you agree to in order to keep the money. And then you have to provide just basic details about your financial details. And I can have that, we can add that to the next webinar and go over that again, so you can see what that is.
Okay, great. And then some more questions. We've gotten these several times following up. So just providing more detail on specifically how the money will need to be spent when you say COVID expenses. Does that also include provider salaries?
If you're hiring additional providers or paying overtime, or, you know, it doesn't have to just be providers. If you're hiring extra people, paying overtime, whatever expense, I guess really the easiest way to say it, employee expense, HR expense, if it's directly because of COVID, then that's fine. You can use it for that.
Great. Thank you for clarifying that.
Sure.
Someone did write in regarding the CCN. They also mentioned CCN used to be a PTAN number as well.
Oh, okay. I didn't know about that one.
All right. And is there a third stimulus payment if they haven't found their second payment?
Possibly. I can't speak definitively to that. You would need to call Medicare.
Okay, so anyone who is having trouble identifying if they've received payment or not, follow up with CMS is the best way to find that. All right, and as far as attestation, getting a few more questions on this, is there a specific form or electronic message for attesting?
Yes, there's a link that you go to called the Provider Relief Fund, and Ellen or I will put that into the presentation before we send it today, so that you can just link to it. It takes you right there to jump into the attestation.
All right, and how long do they have to attest after receiving the funds in their bank account?
Just before the I'm sorry, there is a like a formula for that. Let me answer that separately.
Okay, we will follow up with that one separately here. And let's see, it looks like we have covered most of these questions. Just a lot of these that are very similar regarding any limitations on what the funds can be used for and how they can attribute the funds to paying for staff.
So it's really unlimited what you can use the funds for, as long as you can show that it was in response to COVID or for COVID. As far as, so when you're documenting your staff, the extra expenses for staff, then there would need to be some way for you to demonstrate, if you were audited, that how you had to increase your staff or change it. Therefore, that money went to that particular expense.
All right, and another question just came in here. Does the RUCA score have any determination on whether or not we receive funding?
I do not know. I'll have to look that up.
All right, Chris, we will follow up with you regarding that after the webinar today. Let's see, we have a few more minutes left if y'all have any additional questions. And for everyone who is interested in the form or the website where you go to submit your attestation, we will include that in the presentation. If you go next past this slide we're on here, there is a sources slide that have some helpful links, and we will include that in the follow-up so you'll have access to it. And another question just regarding employees and payment for them. So if employees are working beyond what they were before COVID and they're also exposing themselves to these sick patients, they can apply the funds to those employees to give them bonuses or help pay their salaries. Is that correct?
Yes, that's correct.
All right, thank you for that. Another question came in, is there a link to the final rule? I believe yes.
Yes, that is one of the links at the end of the presentation.
Yes, so that is also included here. You can see on the sources slide. We'll make sure we add any additional ones that have been brought up during the Q&A, and we will send that out following the call.
So it's the second link, the additional policy and regulatory revisions. That's the link to the law. This first one is a link to the CMS press release, and I'm not sure what that second one is. I think, did you add that one, Ellen, or did I do that? That's to the article.
Yeah, I added some in there as well. And then we got one more question. If we are also using funds from the Paycheck Protection Program, how does this affect the money we receive for being an RHC? And also tagged onto this is the terms and conditions we have to accept mention reimbursement from other sources and not being able to use these funds for those same expenses. Can you clarify this?
So when you say, hopefully you can add more details. When you say the money that we get for being an RHC, are you speaking of outside of COVID? And if that is the case, I will need to research that. I can't answer that one right now.
All right. So we can follow up with that one separately, and that was Erin. We will follow up there. Oh, and okay, so she did add some extra context in that, so we'll just follow up with her separately.
Thank you.
And I think that will conclude today's Q&A session. So if there's any questions that we were not able to address on today's call, we will follow up with you via email, and you can explain a little bit further. Margaret will have time to do some research for any additional ones. As we mentioned at the beginning of the webinar, there are new updates being released weekly, sometimes daily. So we're also trying to figure all of this out at the same time and help provide some guidance. So I want to thank everyone for attending today's webinar, and a special thanks to Margaret. As a reminder, the slides will be shared in a follow-up email, which will also include a link to the recording if you want to review again, and you can also share with any of your peers. So on behalf of Azalea Health and our presenter, thank you for joining us, and have a great rest of your day.